Explanation: lidocaine ventricular arrhythmia कंट्रोल करने वाली एंशरिथमिक ड्रग है। Q6. Piperazine is used in human anthelmintic C. A. Piperazine. B. Insulin. C. Omeprazole. D. Digoxin. A. Explanation: piperazine intestinal worms के ट्रीटमेंट में यूज होती है। Q853. Which drug is a potassium-sparing diuretic? A. Spironolactone. B. Furosemide. C. Mannitol dihydrochlorothiazide. Spironolactone. Spironolactone antagonizes aldosterone receptors and conserves potassium. Q854. Which drug is used for emergency treatment of hypoglycemia? A. Glucagon. B. Insulin. C. Metformin. D. Pioglitazone. Glucagon. Glucagon raises blood glucose by stimulating glycogen breakdown in the liver. Q856. Which drug is commonly used in bipolar disorder? A. Lithium. B. Diazepam. C. Fluoxetine. D. Haloperidol. Lithium. Lithium stabilizes mood and is used in manic depressive illness. Q857. Which drug is an antifolate antimalarial drug? A. Pyrimethamine. B. Chloroquine. C. Primekine. D. Quinine. Pyrimethamine. Pyrimethamine inhibits folic acid synthesis in malarial parasites. Q858. Which drug is used in acute asthma attack? A. Salbutamol. B. Propanolol. C. Atenolol. D. Digoxin. Salbutamol. Salbutamol rapidly relaxes bronchial smooth muscle through beta-2 stimulation. Q859. Which drug is a first-generation antihistamine? A. Clofeniramine. B. Cetirizine. C. Loratadine. D. Fexofenadine. Clofeniramine. Clofeniramine blocks H1 receptor. Methadone is 1. Methadone is a long-acting opioid used in opioid substitution therapy. A. Diazepam. B. Methadone. C. Aspirin. D. Atropine. B. Explanation: methadone opioid dependence treatment में यूज होता है और इसका एक्शन लॉन्ग ड्यूरेशन का होता है। Q2. Lidocaine suppresses abnormal ventricular ectopic activity. A. Lidocaine. B. Paracetamol. C. Insulin. D. Digoxin. A. Explanation: lidocaine ventricular arrhythmia कंट्रोल करने वाली एंशरिथमिक ड्रग है। Q6. Piperazine is used as a human anthelmintic C. A. Piperazine. B. Insulin. C. Omeprazole. D. Digoxin. A. Explanation: piperazine intestinal worms के ट्रीटमेंट में यूज होती है। Q853. Which drug is a potassium-sparing diuretic? A. Spironolactone. B. Furosemide. C. Mannitol dihydrochlorothiazide. Spironolactone. Spironolactone antagonizes aldosterone receptors and conserves potassium. Q854. Which drug is used for emergency treatment of hypoglycemia? A. Glucagon. B. Insulin. C. Metformin. D. Pioglitazone. Glucagon. Glucagon raises blood glucose by stimulating glycogen breakdown in the liver. Q856. Which drug is commonly used in bipolar disorder? A. Lithium. B. Diazepam. C. Fluoxetine. D. Haloperidol. Lithium. Lithium stabilizes mood and is used in manic depressive illness. 857. Which drug is an antifolate antimalarial drug? A. Pyrimethamine. B. Chloroquine. C. Primekine. D. Quinine. Pyrimethamine. Pyrimethamine inhibits folic acid synthesis in malarial parasites. Q858. Which drug is used in acute asthma attack? A. Salbutamol. B. Propanolol. C. Atenolol. D. Digoxin. Salbutamol. Salbutamol rapidly relaxes bronchial smooth muscle through beta-2 stimulation. Q859. Clofeniramine. B. Cetirizine. C. Loratadine. D. Fexofenadine. Clofeniramine. Clofeniramine blocks H1 receptors and commonly causes sedation. Q860. Which drug is used for organ transplant rejection prevention? A. Tacrolimus. B. Paracetamol. C. Aspirin. D. Ibuprofen. Tacrolimus. Tacrolimus suppresses T lymphocyte activation and prevents graft rejection. 161. Which drug is used as an anti B. Levothyroxine. C. Insulin. D. Metformin. Propylthiouracil inhibits thyroid hormone synthesis and peripheral conversion of T4 to T3. Q862. Which drug is a cephalosporin antibiotic? A. Ceftriaxone. B. Doxycycline. C. Azithromycin. D. Ciprofloxacin. Ans. Ceftriaxone inhibits bacterial cell wall synthesis. Q863. Which drug is commonly used in rheumatoid arthritis? A. Methotrexate. B. Omeprazole. C. Digoxin diazepam. Ans. Methotrexate. Methotrexate suppresses immune activity and reduces joint inflammation. B. Atenolol. C. Aspirin. D. Metformin. Ans. Diazepam enhances GABA activity and rapidly controls seizures. Q865. Which drug is an osmotic diuretic? A. Mannitol. B. Furosemide. C. Spironolactone. D. Hydrochlorothiazide. Ans. Mannitol. Mannitol increases osmotic pressure and promotes water excretion. Q866. Which drug is commonly used in glaucoma? A. Timolol. B. Atenolol. C. Propanolol. D. Digoxin. Ans. Timolol. Timolol decreases aqueous humor production and lowers intraocular pressure. Q. Which drug is used as an antiplatelet agent after myocardial infarction? A. Clopidogrel. B. Heparin. C. Warfarin. D. Morphine. Ans. Clopidogrel. Clopidogrel inhibits ADP-induced platelet aggregation. Q868. Which drug is a selective serotonin reuptake inhibitor? A. Sertraline. B. Haloperidol. C. Diazepam. D. Lithium. Ans. Sertraline. Sertraline increases serotonin levels in the CNS and is used in depression. Q869. Which drug is used for fungal skin infection? A. Clotrimazole. B. Acyclovir.